Hi, everyone. Good afternoon. I'm so excited this afternoon to be talking to you about how we can serve some new Americans and work with Ascentria Care Alliance in supporting some new families. My name is Liz Keating, and I'm a volunteer. I support a family that's in Arlington, and I'm here with Aimee Mitchell, who's with Ascentria Care Alliance. So what we would like to do today is go through an agenda of things. We'll both give some introductions about ourselves, talk about what does it mean to be supporting refugees and resettling, talk about what is this thing called a neighborhood support team, which is a care model, and give some background about Ascentria. And then we'll turn to talking about a specific example of a particular NST, the one I've been involved with, supporting a family here in Arlington. So to move to, let's go back, sorry, to welcome and introductions. Aimee, do you want to introduce yourself?
Sure. Thanks, Liz. I'm Aimee Mitchell. I work at Ascentria Care Alliance, and one of the programs that I see within our community services is our support for new Americans. Liz and her team have just done astounding work, so it's an incredible privilege for me to co-present and talk to you all about the work that they've done, because it is really pretty stellar and standout.
Great. And so my name is Liz Keating. My day job is I'm a CFO for a nonprofit in Cambridge, Massachusetts. And one of the things I do in my free time is work on supporting this family. So now working to talk about what does it mean to be supporting a refugee. I thought maybe, Aimee, you could give a little bit of background of the landscape here in Massachusetts and what this community-based support model.
Absolutely. Thanks, Liz. I appreciate it. So I have been doing work of refugee resettlement for roughly a year or so as I transitioned into this new job at Ascentria. It was about 6 weeks before the fall of Kabul. So I was on a pretty fast-paced learning curve. And one of the things that I had quickly realized is that resettlement and arriving to the country as a foreign-born person is very complex. And the way that the models are currently being done, primarily through the resettlement agencies, sets out an expectation that the work of resettlement will be done in about 90 days. There's different time frames, there's different activities. It is incredibly isolating and traumatizing for the people that are arriving. It's just not enough. And so one of the things that we did last fall was work on this idea of a neighborhood support team. And what it does is this idea is that it's communities that welcome people to their neighborhood. It's not case managers, it's not agencies, it's communities. And by building these relationships, by having these informal supports, by having someone that you can go to the grocery store with, or having someone that will help you enroll your kids in school, but also somebody that you can just call up and ask a question, the results of this have been stunning. And when I look at the folks that we've resettled through the traditional model, the degree to which they feel isolated, they don't feel supported, they feel disconnected. And then I look at those folks that have been supported through a neighborhood support team, the comparison is just off the charts. So it's a truly incredible endeavor for the people that are arriving. Liz, do you want to talk a little bit about what an NST does?
Yeah. So I'll get in a little more detail later of the exact way our NST formed itself, which was into a bunch of small committees. But generally what an NST is 20 to 30 volunteers. I think you're asking for a 1-year commitment. Our group is just arriving at the 1-year mark. And some of us are so engaged with the family, we're actually talking about when would we actually end our commitment. They're become dear friends of ours, and we will continue to support them. So the main thing right now they're working on is driver's licenses and getting a car. We formed just actually by one person who's on our NST having had dinner with another person who had joined a group that was supporting a family. And it's just a circle of friends that keeps expanding in order to support this particular family. So we have helped as sort of the key things listed here. We helped the family get housing. We fundraised in order to help pay for the housing and some other costs. We set up the apartment. We got the kids enrolled in school and aftercare and things like that. We supported them in finding jobs and getting insurance coverage, which in Massachusetts is easier than some other states, and lining up some social services. And then my background is I'm a finance person, so I was working a lot with them on budgeting and learning banking practices. And in the back, not in the background, but along with us along the way, were Ascentria case managers who helped them get together. So maybe I'll hand it back to you, Aimee, right now to talk a little bit about who Ascentria is, and then I have another slide about what some of your services are.
Yeah, sure. And what I would say, Liz, as you mentioned that each family that arrives is completely unique. You know, the folks coming from Afghanistan, we needed to do more fundraising for because there was no assurance of benefits, or the folks from the Ukraine, or as we know, the folks from Venezuela or from some of the African countries. Each of them is very, very unique. And so the idea is that we support the work almost as coaches in terms of just having a lot of knowledge and understanding. Ascentria, we're a pretty large nonprofit throughout New England. We are in all of the New England states, aside from Rhode Island at this point. And you'll see from our mission statement is really this idea that it's about communities. It's about building thriving communities. We are very focused on social justice and social equity in terms of trying to understand and knock down the various barriers. And so when we were in a position and advocated for lots of money for the Afghans, we also felt it was important for us to advocate for the Haitians, for the Ukrainians, whatnot. We are based in Worcester, but as you see on the slide, we are throughout New England. To date, through our 3 sites, we have resettled just close to 600 Afghans through 63 neighborhood support teams. They're a complete force of nature. We've got about 1,500 to 1,600 volunteers that have done this work with us. We have matching grants. We have lots and lots of different opportunities. We also have a legal assistance program, an interpreting program. And then throughout community services, you see a broader array. We have a program for unaccompanied refugee minors, for example, where we have kids living in foster homes. We have senior care services, rehab, in-home care. We even have a car donation program out of Vermont, which is pretty cool. And again, it's that idea is that you have to approach these things holistically. You have to look at families as whole groups, not just think about one piece or another in order to really help them get to a different place.
Terrific. Thank you. So I thought maybe I would move to talking a little bit about how our NST came together and the things that we did. The Family Connections Belmont NST, as I said, was created out of a dinner. And at that dinner, there was a church in Belmont that had already formed an NST that was supporting a family. And it turned out, an Afghan family, that the father in that family's sister was on the base in New Jersey, and unless action was taken, would have ended up in Texas. The person at dinner who heard about this was like, that's outrageous. Her family should also be here. And she motivated a different church community to become involved. But just though I've mentioned churches, our NST is in no way religious in nature. I would say about half the people belong to the church involved, and half of us do not. So this group came together to bring this family from New Jersey to the Boston area and move them to Arlington, where the brother was. So we found housing at it's turned out to be good housing at a reasonable rate. A lot of people came together for the apartment setup. I happened to be downsizing at the time, so I walk into their home now, and a number of the pieces of furniture in the living room and their bedrooms is from my home. We did some fundraising, which Ascentria is a nonprofit, so people can give money and get a charitable donation, and we have a dedicated pool of funds to support our family. you know, the church connection there was helpful because a lot of members of the church gave amounts, and when everybody gives a little, it adds up. And then we broke ourselves into committees, and that the committees you can see here are sort of in the order in which they sort of became active. And so there was one kid in elementary school, one in middle school, and one in high school. So there was work to enroll them in the 3 different schools, get them mass health, and get them enrolled in appointments, health appointments. And then we had somebody who was terrific about working on getting what's called DTA, the Department of Transitional Assistance benefits. We've also lined up some utilities discounts, and we're also working on seeing if we could get something through the Housing Authority in Arlington House. Then we worked with Ascentria, which was running some English classes, and then we also found some other English classes that were online Zoom. The family's English has really taken off. As well as cultural orientation, and that was through Ascentria. That was for both the NST members and the families. So that was really helpful to hear from, in our case, an Afghan, to help us understand some cultural things that wouldn't be familiar to us Americans. Clothing drive, and other things to help with personal needs. And then we broke ourselves up into different task force to help with employment. So the mom is now had worked for a nonprofit, is working for a consulting firm, doing comparable work, and the dad was a dentist and is now a dental assistant and on his way to becoming a dentist. Some of the ongoing things where we're supporting them is transportation. So I mentioned they want to have a car, but they don't yet have a driver's license. So we are driving them some, helping the kids with extracurricular activities. I took one of the kids to a piano lesson today, and ongoing childcare and after school. And I think one of the longer term things is budgeting and banking to help them be financially independent and know how to navigate some things. And now sort of the other big thing in addition to a car is actually helping them secure the long-term ability to stay in the United States. And so they're working with Ascentria, immigrant and legal support. I don't know, Aimee, if you want to add a little bit, particularly about what Ascentria offers in some of these areas.
No, thanks. Thanks, Liz. I think you did a fabulous job. We are certainly, again, able to increase our support as well as step our support back. So in some cases, we've been working with NSTs fairly closely, twice a week, because things have been a little bit more complicated, versus a team like this, where we've offered some weekly meetings, drop-in meetings, where folks can just come in, they can ask questions. We've got other NSTs on the call. We have all of our staff on the call. So really, as things come up, not only can you learn from the other NSTs and what they're doing, but you can learn from our staff. The staff that we have employment supports. We certainly assist with all of the health referrals. We are more recently, we are hiring an early childhood specialist to be able to work with us. And we've got a big focus right now on mental health, and specifically mental health through more of a peer support model than the more traditional model that we'd be familiar with in the United States. There are several groups running right now. We have an Afghan women's group that is actually meeting on location, where the women are doing embroidery and work together, and they're talking about what their experience was like, what their journey here to the United States was like. Because one of the things that we do see pretty much for everyone who has arrived to the country under this refugee or humanitarian parolee is that folks are super traumatized. I think, as Liz and her team would attest to you, when you start to hear the stories of the things that people have been through, it's very hard to not be in awe of their courage and their resilience, and the sheer will that it takes to get them from there to here. And so that's sort of a new area that we're heading into.
Yeah, I would agree with you. It's over time that things have come out. When I arrive, sometimes they're on the phone with people in Afghanistan, and then some of these stories come out. And one of the things that we've discovered is the person who's the best English speaker often has, in the family, has a disproportionate amount of responsibilities. So they need to be on calls to help other family members navigate various things.
Yeah.
which in our case, it turns out to be the mom, on top of sort of the traditional motherly duties. So, um, Aimee, I'm wondering if you could talk a little bit about what the immediate need is.
Yeah, so we have this pretty awesome opportunity where there are two apartments that are available at Hancock Village. Hancock Village really stepped forward with much of our Afghan resettlement efforts, so right in the middle of Chestnut Hill. Um, there are 2-bedroom apartments, partially furnished. We probably need to get some additional stuff there. And as you have seen, there are 2 crises happening right now. The first of that is Haitian families that are otherwise homeless are showing up to Boston Medical Center. In many cases, moms are about to give birth. We've also seen some situations where it looks like one of the kids may be diagnosable on the autism spectrum, right? So these are families that have come here to the country really for a specific reason. We welcomed 2 of these Haitian families out to Worcester. I met both of them as I helped set up the apartments. And again, just truly remarkable people. A teeny tiny little newborn with one of the families that was adorable. So they had a newborn and they had a 4-year-old. And then, as you have seen, is we have the crisis with the Venezuelan families that were dropped off to Martha's Vineyard. The families from Venezuela have been transitioned to the military base on Cape Cod, which is certainly a much more sustainable place than the church out on Martha's Vineyard. But we're also looking, as folks have met with and interviewed all of those families, who wants to stay here in the area versus, folks that actually wanted to go someplace else. So there are definitely families. Our goal here is to see if we can get a community group to be able to wrap around these families, to be able to offer them what Liz and the other NSTs have, which is just this warm support and navigation. The resettlement agency would work right alongside the entire time. We would need to do things like background checks and whatnot. We do have access to money. So in the case of both the Haitian and the Venezuelan, there have been some emergency housing dollars that are set aside. So we have money probably to pay for their rent for anywhere from 4 to 5 months, which is a real blessing. They would then be eligible for benefits, and we'll get them started in benefits, refugee cash assistance, all of those sorts of things while we assess where their English skills are and where they'd like to work. We also have 2 of our senior care are right around Chestnut Hill. So I've also talked to them about opportunities if any of the families would be interested in becoming a CNA or being able to work there in the facility. It's typically not a hard thing to find folks jobs. There's lots of jobs out there. I think a lot of it is just helping people get accustomed to the culture here.
Right. Terrific. And you had also mentioned, I think there's some agencies you're working with in the Boston area.
Yeah. So we are very good pals with the various resettlement agencies in Boston, Jewish Vocational Services, Catholic Charities, folks like that. In this case, they may be supporting the Venezuelan families while we're trying to help the Haitian families.
Got it.
And then, of course, at the same time, we have more families arriving. I actually met a Ukrainian couple that is going to be living in Worcester, who is giving birth in about 2 weeks. And so with an administration that has a more friendly policy to folks that are foreign born, I think we have a real opportunity to change the way in which they've been welcomed, to ensure a greater economic vitality. I think probably we haven't realized how much foreign born folks are part of our economy, part of the richness and the tapestry of Massachusetts. Massachusetts has really stepped above and beyond, I'd say, many other states in terms of how welcoming and supporting they are.
Great. So as I mentioned, our NSTs reached the 1-year mark. And so I've sort of canvassed some of the members, and we're eager to support and help another NST informing. There's a number of things that we do. It really doesn't matter where one is located in order to provide help. So I think a number of the things we mentioned we can be helpful with, but some things like transportation, and apartment setup, we actually need someone on the ground right there in Chestnut Hill, probably to be helpful. I don't know, Aimee, if there's some other things you think we haven't covered that would be helpful for people to know.
No, I mean, there's so many details, right? Liz will tell you that, there's lots and lots of tasks, typically in resettling someone formally as a refugee. Neither the Venezuelan nor the Haitian families would be having that same level of requirement in terms of all of the same boxes that the NSTs were working with the Afghan response. But I think I think one of the things that I would just reflect on is it's really life-changing, right? I know this sounds so cheesy, right? I've been kicking around as a social worker for almost 30 years at this point. So I've worked with lots of people in hospitals and communities and all sorts of different things. And I have been truly humbled to stand alongside these people that are arriving to our country and offer them the support to be successful. I just have felt so blessed and privileged to have been able to meet them and to see things from a very different perspective than I have traditionally seen things. So I know that's a bit of a cheesy ending, Liz, in terms of what else could we say? But it differently feels like mission and living your mission. So
Right. I have to say the same thing. This family has been nothing but inspiration to me. And their eagerness to settle in and contribute and be part of the community, and their gratitude for everything people are doing has been inspiring. And I've met tons of people through helping them, NST members and people in different agencies. And this has been one of the most meaningful volunteer experiences for me as well. So I think with that, we'll end the session, and then we'll make this recording available to people. And so if we want to reach out, Aimee, and interested in becoming part of an NST, do you want to provide a phone number or email?
Yeah, absolutely. And so my email is amitchell@ascentria.org. I'm
Okay.
also on the website. So if you head over to the website, I am a member of the executive team. So you'll find
I should have done this before. So Mitchell.
It's all good.
Ascentria.org.
Yeah.
And your phone number?
My phone number is 401-323.
Yes.
5359.
5359. Fantastic.
Thanks so much, Liz.
Okay. Take care. To be in 1 minute touch. Thanks so much. Okay. Bye.